Hey, welcome back to part 2 of pharmacology related to the peripheral nervous system. And in this time we are specifically going to look at more the parasympathetic side of the nervous system. And in this case there are two classifications of medications we need to take a closer look at. And that would be our medications classified as anticholinergics and as ganglionic stimulants. So the objectives for part 2 are that you can describe the main pharmacological effects and the uses of anticholinergic drugs, and that you can describe the main pharmacological effects and uses of ganglionic stimulants. So we're going to start off with a little abbreviation here, ACH. In your readings, you should have come across ACH, and see do you remember what it stands for? Okay, it represents a neurotransmitter, and specifically the neurotransmitter acetylcholine. And acetylcholine is a neurotransmitter specifically within the parasympathetic nervous system. So in this lesson, again, we're going to take a look at drugs that are used to affect primarily the parasympathetic nervous system. So we said acetylcholine is that transmitter that works within that parasympathetic side of the nervous system. And I always think of the parasympathetic side as our kind of like our spa side of our nervous system, our retreat side of our nervous system. When we're talking about the parasympathetic nervous system, typically what we aren't necessarily trying to stimulate it. Usually in the medical world, we're doing just the opposite. Most of our medications that we use with this system are used to block or decrease the effects of the parasympathetic nervous system. So we're going to look at the class primarily known as anticholinergics. And what anticholinergics do is they block acetylcholine, and therefore they decrease the parasympathetic actions in the body. So if we're looking at what the effects are of an anticholinergic, it would be effects that would decrease parasympathetic stimulation. So if we look at the cardiovascular system, if we're going to decrease the parasympathetic, the spa side, if you want to think of it as that, of the cardiovascular system, okay, what we would do then is we would increase the heart rate. If we block acetylcholine, we will increase a heart rate. In the respiratory system, if we block acetylcholine, we will decrease secretions. We will also decrease motility, that is movement through the GI tract. We will slow it down. Because if you think about this, when your parasympathetic system is stimulating, you're digesting your food. And in the central nervous system, we will cause sedation. Okay, we will sedate the central nervous system. So medications that we will commonly use to block the parasympathetic effect, known as anticholinergics, would be atropine and scopolamine. And if you recall, scopolamine was one of the ones that was on your drug summaries that you should have researched. So if you're looking for your classification on scopolamine, it's an anticholinergic medication. And if you went and looked further as to the clinical indications or the common conditions that we used this medication for, one of the things you're going to see with that is motion sickness. And this makes sense because we decrease GI motility, so we slow down contractions and spasms in the GI tract, and therefore we will decrease motion sickness. This is the medication that you will hear people using when they go on cruises. They call it the patch. Comes in, the most common form is that in a patch form, and they put it on, and it keeps them from getting sick when they are traveling. Unfortunately, the side effects that come from that are the other things, such as the decreased secretion, so they will get dry mouth, and sedation, so they will sometimes they can feel tired and that on their trips. Some of the other things we will also use anticholinergic for are irritable bowel syndrome. Again, makes sense, decrease stimulation of the GI tract. Bradycardia, if you have a slow heart rate, as we said, it will increase the heart rate, so it could be used to treat some bradycardia. We'll use it preoperatively to help, number one, with the sedative effects. If we give this medication, we may have to give less of other narcotics or anesthetics to help with sedation. But it also, the main reason pre-op is, again, the decrease of secretions. If in the operating room we do not, if we are intubating, we cause increased secretions, and we want to decrease the chance of someone aspirating fluids down into their lungs. So these type of medications are really good preoperatively to help with making surgical procedures go a little smoother. And then the last one that you all see anticholinergics used is for an overactive bladder, someone who has urinary frequency, not due to necessarily an infection, maybe just due to age and due to some neurological effects causing some incontinence. So we will sometimes give anticholinergics to help decrease the amount of trips someone needs to make to the bathroom, decreases spasms of the urinary tract. Then the next one that we're going to look at in here is that of the ganglionic stimulants. Acetylcholine is also the neurotransmitter for your autonomic ganglia. And the autonomic ganglia have what are called nicotinic neural receptors. Nicotinic neural receptors. Sounds like something else, doesn't it? The common stimulant for the autonomic ganglia is nicotine. Nicotinic neural receptor, nicotine. Makes sense. So people who use tobacco absorb nicotine, which then stimulates the autonomic ganglion in the body. So what's the body's response when someone does smoke tobacco? What happens? What happens with this stimulation of the ganglion? Well, typically what you see after someone smokes tobacco is you usually have an increase in heart rate and an increase in blood pressure. You may also see an increase in gastrointestinal activity. And over time of doing this repeatedly, people get used to that feeling, used to that higher blood pressure, used to that heart rate, and eventually you can get dependence on the nicotine. So they become dependent upon it. Well, as we also know, particularly with our tobacco products, there are not so nice side effects of smoking, and the multitude: heart disease, cancers, pregnancy, fetal effects, and that. So there's numerous reasons for not smoking. So if we have someone who comes in who is going, okay, I want to stop smoking cigarettes, that's the most common use we have for a ganglionic stimulant. And what we do is we give nicotine, the ganglionic stimulant nicotine, in another form to assist someone to decrease and eventually stop smoking cigarettes. So what happens is, I have the patch pictured here, but it comes in a variety of different forms. We actually continue to give them the nicotine, which is the primary stimulant that is located in the tobacco, but we give it in another form other than smoking. And over time, we gradually decrease the dosage until they've gotten to the point where they are no longer dependent on that feeling that they get, that increased heart rate and increased blood pressure with the nicotine, in the hopes that at that point they can discontinue the nicotine altogether and they will no longer smoke cigarettes and have broken that habit that they have developed. Some cases it works, and some cases it don't. I chuckle because at this, because I've also seen people use this for other reasons, such as they have a period of time where they're not going to be able to smoke, such as you may see them in the hospital, or I always give this great example of my mother-in-law, who was going to a class reunion, and none of her classmates that she was going to be with smoked, and so she put the patch on so that she could spend the day with her classmates without having to leave and have a cigarette. And then as soon as the reunion was over and she came home, she took the patch off and lit up a cigarette. So there are people who do abuse these, and you do need to keep an eye on that when people are requesting or looking for a ganglionic stimulant. Kind of got to get a feel for exactly, are they truly going to using it to quit, or do they have an alternative reason? Of course, as a side note, we know that the best way to get someone to stop smoking is to also that they should have some type of counseling therapy going along with it to help them with the psychological portion of the addiction that they have to the cigarettes. So I'll get off of my soapbox there with the cigarettes for now, and with that then we conclude part 2 of our lecture, which included ganglionic stimulants and our anticholinergic medications that affect the parasympathetic nervous system.